My name is Solange. I am 58 years old. I am 5 feet 3 inches tall. I underwent surgery on June 8, 2023, using Dr. GOFF's technique. Currently, I weigh 198 pounds. Before my operation, I weighed 220 pounds, and in 1.5 months, I lost 22 pounds. Okay, so before getting a sleeve surgery, well, I work in a hospital environment. And I have colleagues who, when I had the sleeve, approached me telling me they also had a sleeve but had gotten the sleeve before me. Now, all of them, even the one that had a bypass and the other 3 had a sleeve, all of them, I repeat, all of them, even with the bypass, they regained weight. And rapidly. I mean, when they regained their weight, it shot up. It went up fast, and I've seen them. I've talked to them. They talk about so-called dietary rebalancing. But for me, that doesn't work since they are really overweight now. I talk to them, and I hope I can convince them that there is a better way. For example, I have one colleague who had a sleeve 2 years before me, and honestly, she lost weight. So she approached me and she told me she had a sleeve like mine. Well, honestly, she had lost weight. She could wear a size 12. Now, I couldn't ask her about her weight. Now, she's in size 18. 10 years later, she's in size 18, and she's still climbing. She's regaining a lot of weight. On the other hand, I also have a colleague who had a bypass, and she's also regained weight. I don't understand why, because I thought to myself that the bypass worked better than the sleeve, but she regained a lot of weight because when I met her, she could wear a size 12, and now she's in size 18. She is regaining weight. I cannot advise someone to do it. I didn't even want to talk about the bypass because even the colleagues who had a bypass, they started directly with a bypass and they lost a lot of hair. They had to take vitamins and had some really strange deficiencies. No, the bypass, no. I can't advise anyone to do it. I didn't even want to talk about the bypass because even colleagues of mine who had a bypass started directly with it. They lost a lot of hair, had to take vitamins, and had some really strange deficiencies. No, the bypass, no, no, no. The advice I would give to anyone who, like me, underwent a sleeve procedure due to a lack of information is to opt for Dr. Legoff's technique. We truly have this opportunity. The chance that after a major operation like the sleeve, we can have a second chance with an alternative technique. One that could even be considered before committing to a sleeve. Here's what I say. Visit Dr. Legoff for his technique, which is now a safe and lifelong one. Additionally, you won't need to undergo further surgeries because in any case, in my circle, there's someone who started with the sleeve. She lives in Lyon, and then she went in for a bypass. And even with the bypass, she may still be a size 18. But it's just a shame that I didn't know about him back then. I didn't know Dr. Legoff at the time. But see, here is the problem. The bypass resolves the issue for a while. But when life returns to normal, because life is going to return to normal. See, if you were used to eating a lot with the bypass, I can tell you 100% it is certain that you will gradually start eating again until you regain weight.